Hi, I'm Dr. Betty Maloney. As you may have discovered, there's lots of myths and misconceptions about Lyme disease. In this presentation, I'll cover the basic facts about Lyme disease in Minnesota. I hope you find it helpful.
Hi, and welcome to Lyme disease in Minnesota. I'm Dr. Betty Maloney. I wrote this presentation on behalf of the Minnesota Lyme Association. MLA provides support services to patients with Lyme disease and works to prevent new infections. Today's talk is about protecting you. We'll cover these four main topics. 1. Why MLA wants you to know about Lyme disease. 2. How Lyme may affect you. 3. How you can become infected. And 4. What you can do to prevent that from happening. Here's why you should learn about Lyme disease. For starters, it's the most common vector-borne illness in the United States, and case numbers have been increasing. Most people who get Lyme will be successfully treated, but for some, Lyme becomes a debilitating chronic illness. The risk of getting Lyme disease is much higher than most people recognize. In some ways, Lyme is like an iceberg. The CDC used to emphasize surveillance case numbers, but surveillance cases are a special type of case. Think of them as the tip of the Lyme iceberg, with the rest of it hidden from view under the water. Do you know how many cases are underwater? If your answer was around 90%, congratulations. The answer is based on the CDC's 2013 estimate that 300,000 new cases of Lyme disease occur each year in the United States. That's roughly 10 times higher than the approximate 30,000 surveillance cases that are reported annually. Lyme disease can cause serious problems. Not only is it costly, it can be disabling and reduce someone's ability to work or go to school. A national survey of people who reported having chronic Lyme disease found that 2/3 reduced their school and work hours, and 1/4 received disability payments. Only a few doctors in Minnesota know how to treat complicated cases of Lyme disease. Most of the others have been led to believe that Lyme is relatively uncommon and doesn't cause chronic problems. Because they simply don't see the need for advanced training on Lyme disease, we're left with a shortage of qualified doctors, and many Minnesotans leave the state to obtain care elsewhere. Understanding your overall risk of Lyme disease is the first step in preventing it. Looking at this map of the reported cases that meet the special surveillance case definition, you can see that most cases are concentrated in the Northeast and Upper Midwest. But if you scan the map, you'll also see pockets near Seattle and San Francisco, and cases all along the Gulf Coast. The rest of the country has scattered cases. Cases are reported based on where the patient lives, and that may not be where they were infected. For example, a case reported in Montana might have been picked up during a trip to Connecticut. Even within the high-risk states, the risk is not equal. Looking at the map of Minnesota and Wisconsin cases, you can see they form a single band running through specific areas of each state. Let's talk about the risk in Minnesota. Our state is always in the top 10 states with the highest number of reported cases. Going back to our iceberg analogy, it's more likely that there are 10,000 cases each year in our state, rather than the 1,200 or so that our health department reports to the CDC. Blacklegged ticks, which are often called deer ticks, transmit Lyme, and they are found throughout the state. Most people think of rural areas and forests, but there are plenty of ticks in the metro. Ticks can be found at campgrounds and parks, in the rough of a golf course, and possibly in your own backyard. The risk map from the Minnesota Department of Health shows the relative risk of becoming infected with Lyme disease or another tick-borne disease called anaplasmosis. The darker the color, the higher the risk. So only those Minnesotans who live in the southwestern part of the state and never travel outside that region are seemingly safe from Lyme disease. But people do travel. so most Minnesotans are at risk, but some more than others. Anything that puts you in tick habitats puts you at risk, and a few things are listed here. Even if you stay clear of those areas, if your pets are allowed to roam outside, they may bring a tick home to you. Owning cats that go outside carries more risk than owning a dog. Risk is also related to age. This graph shows that school-age kids have the highest risk, followed by middle-aged adults. Before we get too far, let me give you a brief overview of Lyme disease. Lyme is a bacterial infection. Humans and animals can become infected if they're bitten by an infected black-legged tick. Lyme has 3 distinct stages: early, late, and post-treatment. Not everyone goes through each stage. Symptoms vary from person to person. Lyme disease is caused by Borrelia burgdorferi, which is actually a family of bacteria. In the U.S., we only have 1 major species, but Europe has at least 3 to deal with. Individual species differ from each other in ways that can affect test results and treatment. Plus, each species may have dozens of variations known as strains. The bacteria is sneaky. It can adapt to life in a wide variety of host animals without being killed by their immune systems. Getting back to the illness, it's important to recognize that no 2 patients look the same, and an individual's symptoms often change from day to day or week by week. In early disease, the bacteria is only in the skin, but later on it spreads throughout the body. It especially likes to attack nerves, joints, and the brain. Both of these stages need to be treated with antibiotics. Despite treatment, some people never get well. These folks have post-treatment Lyme disease, which is sometimes called chronic Lyme. Early Lyme usually begins 1 to 2 weeks after a tick bite, but it can show up anywhere from 2 to 30 days. It has 4 main forms. Some people have no symptoms. Others have an erythema migrans rash. A third group may feel like they have a summertime flu with fevers, chills, and body aches, but no rash. The fourth group is the luckiest. They have the rash and feel fluish. I consider them lucky because they're more likely to be correctly diagnosed and treated early. Although many doctors still order blood tests for patients with early Lyme disease, it's important for you to know that the results often cause confusion. The tests look for antibodies to the bacteria, but it takes time for your body to make them. Studies have shown that most people will test negatively when they develop their rash. These false negatives may mislead your doctor into thinking that Lyme has been ruled out, but that simply isn't true. Treatment for early Lyme disease requires at least 3 weeks of an oral antibiotic such as amoxicillin, Ceftin, or doxycycline. I analyzed the U.S. trials and found that too many people remained ill if they received less than 20 days of antibiotics. The hallmark of early Lyme disease is the erythema migrans rash, which is often abbreviated to EM. The rash has to be bigger than 5 centimeters or about 2.5 inches to satisfy the surveillance case definition. This picture shows the typical appearance of the rash, a solid colored oval. The color can range anywhere from a faint pink to a very deep red. The classic bullseye rash is the best known type of EM rash, but it isn't very common. EMs will expand and then clear over many weeks, whether or not you've been treated with antibiotics. The rash clears quickly once antibiotics are started. It may surprise you to hear that according to the CDC statistics, 30% of all Lyme disease patients never develop a rash during the early phase of their illness. Here are a few more EM examples. At 11 o'clock, you see the classic target lesion. Remember, it's not very common. The rash next to it is pretty faint. On people who are darkly pigmented, the rash might look like a bruise. Depending on its location, an EM may be mistaken for ringworm or eczema. It can also look like a different skin infection called cellulitis. That can be a problem because the antibiotics that are commonly used for cellulitis don't work for Lyme disease. Here's my suggestion. If you're diagnosed with cellulitis during a time where ticks are out in your area, ask your doctor to give you Augmentin or Ceftin. These antibiotics will work for both cellulitis and Lyme disease. In late Lyme disease, the infection isn't confined to just the skin. By entering blood vessels in the skin, the bacteria can travel throughout the body. Where it finally settles often determines what symptoms a person will have. This is a short list of symptoms or problems that are commonly seen in late disease. These symptoms usually start a few weeks after the bite, but some may not show up for several years. The fatigue and pain that occurs in this stage can be disabling. I recall one patient who said she couldn't get out of bed even though the baby was crying. Many people have pain from Lyme arthritis, but the pain we're talking about here is due to nerve irritation from the infection. This nerve pain, or neuropathy, is very similar to the pain of diabetic neuropathy. As we know from commercials, certain medicines can eliminate the pain from diabetic neuropathy, and those same medications often work for Lyme pain. I'll now review a few of the most common forms of late disease. Sometimes people will suddenly develop multiple Lyme rashes. Although it might seem like they have several simultaneous tick bites, what really happened was that the bacteria circulated in the bloodstream and then returned to the skin in multiple places. Another common problem is facial nerve palsy, which is when the muscles on one side of the face don't work. Bell's palsy is a form of facial nerve palsy, but in that situation, doctors don't know why the nerve isn't working. And they commonly try treating it with steroids. That's a bad idea if you actually have Lyme disease and not Bell's palsy. Here again, test results can be falsely negative. So, if you develop facial nerve palsy during the summer, make sure your doctor strongly considers Lyme disease and doesn't rely on blood tests to rule it out. Many experts advise treating for Lyme disease and avoiding steroids. Months or years later, 60% of those who are infected but untreated will develop Lyme arthritis. The knee is the most commonly affected joint, but it can hit anywhere. When small joints are involved, people might be misdiagnosed with rheumatoid arthritis. When the infection spreads to the heart, it can cause a lot of inflammation, which can be deadly. The CDC recently published case studies about previously healthy adults who died from Lyme carditis. The electrical system is most commonly involved. It causes the heart to beat irregularly. Brief episodes of a rapid heartbeat can occur, but the real worry is that the heart will beat too slowly. Some patients will need a temporary pacemaker. When the heart muscle is involved, the heart can't pump blood well enough, and people have symptoms of heart failure. Rarely, the infection causes inflammation of the outer lining of the heart. This produces pain when the person takes a deep breath. Lyme can get to the brain and infect the tissue that covers the brain and spinal cord. This is meningitis, and it causes headaches and neck stiffness. Lyme meningitis is described as smoldering because other bacterial causes of meningitis cause more dramatic symptoms from day one. Blood tests can be falsely negative, and lumbar punctures, often known as spinal taps, may show only slight abnormalities. That's why many patients with Lyme meningitis are misdiagnosed with viral meningitis. Aside from Lyme meningitis, late neurologic disease is the form of Lyme disease that can be especially hard to recognize. It usually develops months or years after a bite, and we don't know how many people are affected. In this stage, the brain and nerves aren't working properly. Since the nervous system controls so many aspects of our bodily functions, people have a wide range of symptoms such as numbness, tingling, nerve pain, difficulty thinking, loss of math or language skills. They may also develop psychiatric conditions such as depression or anxiety. Lyme also mimics several nervous system diseases, including dementia, Parkinson's disease, ALS, and MS. There aren't many definitive tests for these illnesses, so people who are diagnosed with one of these illnesses and who are at risk for Lyme disease should be sure that their doctor has considered the possibility of Lyme. Lyme disease symptoms are so variable that no two patients look exactly alike. And because Lyme can mimic other diseases and blood tests are often unreliable, it can be very difficult for doctors to make the diagnosis. I don't want to go into all of the problems with testing, but it's important for you to understand that Lyme tests tend to be insensitive. They miss people who actually have Lyme disease. There are lots of reasons for this. For example, the test can be wrong if you're tested too soon or too late. So, while positive results in someone with symptoms of Lyme disease usually indicate an active infection, negative blood tests for Lyme disease cannot be used to rule it out. Doctors who suggest otherwise are wrong and probably don't know the facts about testing. Here are some of the many diseases doctors have to consider when they're evaluating someone who may potentially have Lyme disease. It's likely that they'll need to run lots of tests. That's a good thing because the goal is not to diagnose everyone with Lyme. The goal is to diagnose everyone correctly. As I mentioned earlier, Lyme is a bacterial infection, so antibiotics are required. Treatment works best early on, during the rash phase, but even then antibiotics don't always cure people. Patients who remain ill have post-treatment Lyme disease. No one knows why some people remain ill or what to do for them. Many theories exist, but few have been proven. One thing that is known is that the bacteria has ways to trick the immune system and to avoid being killed by antibiotics. It is also known that some Lyme patients will improve when they receive additional antibiotics. There may also be other things to try. This uncertainty has led to disagreements and medical controversy. We really need more research in order to get everything figured out. Let's go back and talk deer ticks, because without them, Lyme wouldn't be an issue. This picture shows the tick's distinctive appearance, a black cape against a reddish-brown body. Deer ticks live for 2 years and they can survive the harshest winters. Larvae hatch from eggs in the spring of year 1 and seek a meal. Once fed, they become nymphs and essentially sleep until the spring of year 2. They take a second meal and molt into adults. Adults mate and the male dies. The female may take a third meal before overwintering. Once she lays her eggs the next spring, she dies, and the cycle repeats itself. Every meal is a chance to become infected, and once a tick is infected, it remains infected. Subsequent feeding allows it to spread the infection. Larvae don't hatch out infected, so if you're bitten by a larva, you won't get Lyme. Only nymphs and adults can give you Lyme disease. Ticks dry out easily, so they require a habitat that is moist. They like the shade in areas where moisture is trapped. Places like long grass, leaf litter, fallen logs, and the edge of the woods. Tick-friendly spots around your home would be by bird baths and shady vegetation. Ticks will also be found in areas where mice and other hosts go, such as bird feeders and wood piles. Young ticks are close to the ground, and adults can be several feet higher. Ticks don't jump or fall from trees. They move short distances on their own or on small mammals. Long-distance travel is by deer or birds. Blacklegged ticks don't go and find a host. Instead, they wait for it to come to them. These ticks crawl to the edge of vegetation, wait for something to pass by, and then grab on to whatever brushes into them. Tick species can be identified based on their appearance. That's important because only black-legged or deer ticks transmit Lyme disease. These pictures highlight the differences between the species. The deer tick is on top. Below it are the dog tick, which we Minnesotans usually call the wood tick, and the lone star tick. The dog tick has a white cape, and the lone star has a single white dot on its back. Although you can tell ticks apart based on their appearance, using size is unreliable, especially when the ticks have been fed. Based on what you just learned about tick appearance, can you look at these two ticks and tell me which is which? If you look closely at the top picture, you see a white cape, making this a dog tick. Blacklegged ticks spread more than just Lyme disease. These other infections are called coinfections. So far, 7 have been identified. They're listed in this table. Expect to see more. The table also shows the diseases carried by dog ticks and lone star ticks. Star eye stands for Southern Tick-Associated Rash Illness. It looks and behaves a lot like Lyme disease. Co-infections really complicate the picture because many of these illnesses look a lot like Lyme, and it can be difficult to know which infection a person has. People can have more than one infection at a time. Those with multiple infections will have more symptoms and be sicker. Some of the co-infections need antibiotics that are entirely different than what's used for Lyme disease. So people with more than one infection might find themselves on combinations of antibiotics, and it might be harder for them to get well. Because Lyme disease is a serious illness that's increasingly common and tricky to diagnose and treat, we should make every effort to prevent it. Since we live in a high-risk state, there are many ways to get exposed to ticks. Think of prevention as a 3-legged stool, and unless you pay attention to all 3 legs, people, pets, and property, there's a good chance the stool will tip over and you'll be bitten. For people, avoiding tick bites is key. This means it's important to know if you live, work, or play in an area that harbors deer ticks, and to stay out of those areas whenever possible. Sometimes that information isn't available, so if you're in tick-friendly habitat, assume they're there. If you can't avoid being exposed to ticks, it's important to take steps that reduce the chance of a bite. Proper clothing and the use of insecticides and repellents can really help. Because those defenses can fail, you also need to do a tick check after each exposure. And if you find an attached tick, you should talk to your doctor about taking antibiotics to prevent the infection from starting. Here are the details for these different prevention strategies. The woman in this photo may not be stylish, but she sure knows what to wear to reduce her risk of Lyme disease. As far as clothing goes, the key idea is to cover as much skin as possible because ticks can't bite through clothes. Wearing light-colored clothing makes it easier to spot any ticks that are crawling on you. You definitely need to tuck your pants into your socks so that the ticks can't crawl under the cuffs and onto your legs. People with long hair should consider wearing it in a ponytail and putting it under a hat. All of your clothing should be pre-treated with Permethrin. When you come in from tick habitat, take your clothes off and before walking through your house, put them in the dryer on high heat. You might need 15 minutes if your clothes are dry, and you'll need longer if they're damp or wet. Drying your clothes will kill ticks by dehydrating them. Washing alone won't kill ticks. I said clothes should be pre-treated with Permethrin. Here's why. Permethrin is an insecticide, and it kills ticks on contact, yet it's safe to use on clothing and gear. It provides long-lasting protection, usually 2 to 6 weeks, because once it dries, it bonds tightly to whatever it's on. Items treated with Permethrin can get wet or even washed and still be protected. Some clothing lines have Permethrin embedded in the fabric, and the manufacturers say that the protection lasts through 70 washings. Regarding safety, the EPA has tested permethrin extensively and found it to be very safe. The military agrees and uses permethrin-embedded fatigues in tick areas. By the way, although permethrin isn't supposed to be applied directly to the skin for tick bite prevention, that's exactly what's done when people have a case of scabies. And in those instances, it's put on for 2 days in a row before showering it off. Repellents are different from insecticides. They don't kill ticks. They work by getting the tick to move off of treated areas. There are several types of repellents. This table compares 3. DEET's been around the longest, and it comes in all sorts of formulations. You need at least 30% concentration to repel ticks. DEET can harm synthetic fabrics as well as natural products like rubber and leather. There have been some questions about its safety. While the U.S. EPA thinks it's fine for anyone over 2 months of age, the Canadian Health Ministry discourages its use in children. Picaridin is newer than DEET, but it's been around for many years. It's safe for all fabrics and gear. There's no concern about using it on children. Picaridin comes in sprays, lotions, and wipes. You want a concentration of 10 to 20%. Bio-UD is newer. It's made from wild tomato plants and comes in a spray or lotion. There are no use limits on it, but it needs to be reapplied every 2 hours or so. You won't find it in stores, but you can buy it online. Lots of natural products are said to be good repellents, but they haven't gone through formal testing. Since the other products I mentioned are safe and effective, best to stick with them. Once you come inside after an exposure to tick habitat, you should look to see if any tick managed to attach itself to you. Tick checks need to be body-wide. Ideally, you would come in, shower vigorously, and then do the check. Studies found that if you shower within 2 hours of exposure, you can reduce your risk of Lyme disease. Tick checks are very effective, but they must be done carefully and after each exposure. You also need to remember that your target is very small. Here's a picture of a nymph on someone's fingernail. If you rush through your check, it's likely you'll miss seeing ticks. Should you find a tick attached, it's really no big deal to remove it. You can use a special remover or a fine tweezers. Grab the tick as close to the skin as possible and pull steadily upward. If you use a jerking motion, you'll probably end up leaving the head behind. Don't worry too much if that happens. Your body will expel it. Wash the bite site with soap and water. Antiseptics and Band-Aids are optional. Watch for rashes and flu-like symptoms. Some people are allergic to tick saliva and will develop a red rash around the bite site. This usually happens within a few hours, and unlike an EM, an allergic rash is usually gone within 48 hours of the bite. Save the tick if you can. Your doctor might want to confirm that it's a black-legged tick. In fact, you should call your doctor as soon as possible after a bite. Roughly half of the black-legged ticks in Minnesota and western Wisconsin carry Lyme disease, and bite durations of 24 hours or more carry a risk of Lyme. The longer the tick is fed, the greater the risk. In some instances, it makes sense to take a few weeks of antibiotics to prevent Lyme altogether. I wrote a paper on this topic that was published in the Wisconsin Medical Journal. MLA has a link to it on its website. So, if you get bitten, download the paper and have your doctor read it before the two of you decide what to do. Companion animals generally need the same strategy that we use on humans. Try to keep your pet from entering tick habitat. Animals have different products than humans, and different animal species often need different products. Pets that go outdoors need tick checks just like humans. Ticks might not bite a properly treated animal, but they may use it as a way to get indoors, increasing your risk of a bite. Here are some different things that you can do for pets. Dogs are lucky. There's a vaccine for them. Several items are applied to the animal's coat and others to the skin. The skin products disperse out from the treatment site to protect the entire animal. Collars are another option. Many products are species-specific. Given all the options and potential harm from using the wrong product, check with your vet about what strategies are best for your animal. It's important that you keep your yard as risk-free as possible. Tick-proof the areas in your yard that you use. Clear away areas where ticks can hide or where mice or deer would feel welcome. Don't feed deer or provide salt licks. Avoid using plants that deer eat. Bird feeders attract mice, so move them to areas you don't use. The same is true for bird baths because the water that falls to the ground helps keep ticks from drying out. Keep your grass cut short. Natural sunlight will kill ticks if they don't have moisture. So put play equipment and outdoor furniture in the sun, not the shade. It looks like Bambi is checking out the side. What I want you to notice is the area where the yard meets the woods. This arrangement puts the person that mows the grass at great risk because they'll be brushing into the brush where ticks like to hang out. By putting in a buffer zone, you can cut that risk substantially. Just remember to use non-porous materials that don't hold moisture. In some instances, it makes sense to use insecticides on your property. If you want to apply them yourself, I'd recommend you read the Tick Management Handbook that was developed by experts in Connecticut. It's available online. Google it. You don't have to do the entire property. Focus on areas that would attract mice and/or ticks. Spray the periphery of the lawn, but not the sunny areas. The first year, spray in the spring to kill nymphs and in the fall to kill adults. After that, a spring treatment should be enough. Here's what can be used. Most are available at outdoor stores like Fleet Farm, Home Depot, and Menards. These are toxic in high concentrations, so you'll need to be cautious. You shouldn't treat areas near lakes, streams, or ponds because any chemicals that get into the water will kill aquatic life that's there. It's probably best to have a professional determine if it's safe to treat the area, and if so, let them do it. This presentation can be summarized into a few main points. 1. Lyme is a complex illness that can be tough to diagnose and treat. For some, the infection is costly and disabling. 2. Minnesotans are at high risk for becoming infected, and CDC estimates suggest that roughly 10,000 Minnesotans will become infected each year. 3. Prevention strategies work, especially when they're combined in a multi-layered approach. We have strategies for people, pets, and property, but to work they must become part of your everyday routines at home, and especially when you're exposed to tick habitat. Here are some resources with more information about Lyme disease and prevention. On the bottom is the address for the Tick Handbook that covers landscaping in detail. Instead of copying this down and entering it into your browser, it's probably easier to just Google it. As you look at this black-legged tick, perhaps this twist on a common proverb will make perfect sense to you. Thanks for your attention. Remember to treat your clothes, slap some repellent on your skin, and enjoy our beautiful state.